Hey, how's it going? My name is Mark Nou, and this is my final presentation video for Sociology 101 with Professor Ha. First off, I would just like to thank you, Professor, for a wonderful semester. I took a lot from your class. I will say that I do view society a lot different. I see things that I normally don't see, and that's a good thing. It made me really eye-opening. I'd also like to thank my classmates for all the engaging discussions we had. Good times, good times. All right, so to move on to the subject I chose for my critical analysis essay, I chose health inequalities within the United States. The reason why I chose this particular subject was one day I was just browsing the web and I'd come across this fact, and it was about life expectancies in the US. And surprisingly, I read this fact that if you were a black male in certain parts of rural New Orleans, your life expectancy was around 54 years old, which is relatively low when compared to other Americans, which average around 70 to 80 years old. So this made me really curious on what variables and what factors were causing this to happen. So what I did was I dove into some statistics and I found a lot of very surprising information that I did not know before. Some of the main factors and variables that I will focus on in my presentation is mainly will be race, income, and geographical location. The reason why I'm choosing these three is because out of all the variables and factors that I researched, such as gender, age, job, you name it, race, geographical location, and income were the three had the three largest correlations with health disparities and inequalities, primarily life expectancy. Um, so, for the first factor I'll be looking at is race. And although there's a lot of races within America, one of the certain races that I found that had the was kind of an outlier and had data that correlated to low health was African Americans, and surprisingly, they were subject to more uh, a much more unhealthy life expectancy compared to other Americans, and I did not know that, and I wanted to know why. So, with that being said, one thing I wanted to look at across all Americans was not only life expectancy, but their quality of life and their health. And one thing that all Americans can relate, and we'll all, majority, most of us will face, is heart disease, among with cancer. And it was amazing in a study done by Murray in 2007. It said that blacks had a 35% higher chance of having heart disease than whites in the 1980s. 35%. Hispanics, Asian Americans, you name it, they all differ, give or take, but blacks had a 35% staggering percent chance of having heart disease than their fellow white Americans. Um, of course, there's a lot of variables that could account for this. One of them obviously was income, which I'll get into later, but also the fact that African Americans have been subject to different conditions than any other American living, and that's because of obviously our history of slavery, of discrimination, segregation. It was actually a very interesting fact that I was reading. Although African Americans specifically were subject to 35%, uh, were subject to 35% more chance of having heart disease. Uh, their fellow blacks who were not African Americans, but let's say from Nigeria or South Africa, actually reported having better health than most white Americans. So what that told me was that it wasn't just based on their skin and perhaps prejudice or discrimination, but also their history and their cultural characteristics. So, one of the correlations of African Americans and their health that I found was, like I said, mainly discrimination and racism. Examples such as segregation, which sent a lot of African American families into urban neighborhoods that are often associated with poor living conditions. For example, many urban neighborhoods, primarily filled with African Americans and minorities, are often located next to freeways, major highways, and many factories. And this is no coincidence. This is primarily because these are lower income areas, so companies can get away and do with these toxins and chemicals releasing in the air. Um, another a Another thing I found that related to why perhaps our history could affect that kind of health African Americans are receiving now is because there has been uh, a a distrust between African Americans and doctors and hospitals, primarily from our past and their past. Uh, Evidence has shown that back in the pre-civil rights, there was a lot of testing done on black families, primarily black women, and birth controls. And these birth controls had a lot of side effects, but nobody was really told about it. They were just kind of be testing. They were tested like just like lab rats. And if you had that happen to your family, and you pass it down generation, chances are that 2, 3 generations down the line, there still be a stigma in your family that has a certain distrust for medical services, hospitals, doctors, and I find that sad because it's not really fair. But like I said, it was during unfair times. Um, One example of that was in a hospital in the Stateville Prison Hospital from 1945 to 1970, and as well as a Tuskegee syphilis study conducted from 1932 and 1972. Blacks are actually taken and tested on with these new medications, some without their consent, some with their consent, but it was pretty inhumane. Another explanation for African Americans and their stress in medical services and healthcare can also be linked to systematically poor education and access to knowledge within Black communities. Once again, that goes back to segregating Blacks into poorer neighborhoods, more urban areas where they also aren't really subject to the same quality education as, let's say, a white child in the suburbs of America. Um, Statistically, 15% of blacks have less than a high school education compared to only 8% with non Hispanic whites. Although the education gap between the blacks and whites has been narrowing, data shows that blacks all still receive, on average, lower standardized test scores than whites. I did not look into why was that, but that could also be a contributing factor into why their distrust in medical service, or maybe perhaps lack of knowledge, uh, is correlating with their health. Another major variable that I found that correlated to lower life expectancy and poorer healthcare is geographical location. Many rural and urban areas in America, consisting of lower incomes, have far less clinics, less access to medical attention, fewer hospitals, uh, and it's not only because their population is lower. I mean, roughly 20% of America's population lives in rural areas, but it's just more far spread. It's not as centralized as, say, San Francisco, New York, Chicago, or San Diego. Although only 10% of American doctors work in these areas. And I mean, how many percentage of doctors are Americans are doctors? So you can kind of get the idea there. These areas are more prone to more health related symptoms due to the fact they have less resources and information. A study done in Milwaukee by the University of Maryland showed that low-income neighborhoods in rural areas are more likely to be next to closed hospitals and have physician shortages. Alternative reasons of why those areas have shortages are also due to inaccessible areas, uh, perhaps due to weather, like perhaps let's talk about Alaska, or religious beliefs if you're on a ranch that can't be accessed because of also religious beliefs, because of also maybe population shortages where if they even did have a hospital, there wouldn't be enough patients to adequately uh, suffice for all the costs to pay for the nurses, the doctors, and medical supply, and other reasons. As of 2017, roughly two-thirds of the hospitals that have been opened in the United States have been in higher income suburban areas. And since 1970, approximately a little over 300 hospitals have been shut down or relocated, primarily in rural areas and low income areas that just weren't making profits. And many of these hospitals included nonprofit and for profit hospitals. A majority of these hospitals were small to mid sized community clinics in lower income areas. For example, one of America's lowest income cities, Detroit, has gone from dozens of hospitals in the 1960s to only four hospitals, which is a staggering stat. Just given me living here in San Diego, I mean, I know I can't even count all the hospitals on my hands and my toes. So that was pretty surprising. And for the last factor I'll be talking about that correlates with health inequalities is one's income, which also relates back to the two other factors I talked about, such as race and geographical location. Income plays a role in that because often certain groups of races uh, are often pretty tight knit within the community and often have the same kind of income and same kind of lifestyle, and these can decide where people live, what neighborhoods they're in, what part of town they're in. Like I stated before, African Americans on average are subject to lower income and are often subject to poorer and more urban conditions, versus where whites are often uh, on the higher end of the income spectrum and often are the ones occupying suburban areas where there is many more regulations. I mean, such as HOA, where you got to keep your grass green, right? So, one study done by the University of Michigan from 1978 to the year 2000, researchers found that regions experiencing the largest increases in income inequality also experienced the largest decline in mortality, which is also another way to say that their life expectancy was shorter than those of higher incomes, which is no surprise given the fact that over 300 hospitals in the last decade had been shut down, primarily in lower income neighborhoods, because maybe of the obvious fact that they just weren't making enough. And this also just happens to be during the age of globalization, where a lot of the centralization of money in the U.S. have been dramatically been relocated toward the rich and sent millions toward the poverty line. And with millions sent to the poverty line, with that is a very dynamic shift in health for everybody because it affects where you live. If where you live you can have access to healthcare, if you can even afford healthcare, or if you have a job that can afford you healthcare. Data showed that a lot of lower income neighborhoods, which are majority made up of non-whites and minorities, were at higher risk of mortality, cancer, heart disease, and other diseases as well when compared to higher income white neighborhoods. Another variable that relates to income is employment. Um, Obviously, a lot of employers, if you work full time, you're guaranteed some type or some way of health insurance. And there's a lot of people right now that are unemployed, and with that, they also have no health insurance, especially after Donald Trump has passed this new bill. Um, and that's devastating because without adequate health care and without a full time job, how does one expect a life expectancy as their neighbor who is receiving full benefits? Uh, some say it's not fair. I believe, that's something money you really can't buy. And in conclusion, there are many variables and factors that come into play when examining health inequalities. Uh, Even though it's a very complex and dynamic situation, after my uh, after my studying and analysis of all this data, I believe that the information is very tangible and real. The root and source of these problems can be found and solved. There has been an obvious correlation between poorer health among African American communities, rural areas, and those living in poverty. What I have found is that many of these problems stem from either a lack of knowledge, lack of access to clinics, healthcare, or simply just can't afford any type of healthcare, and as well as isolation, which in result means less patients, less money, less hospitals. Um, it does seem like a very common root of a lot of this is money, and just to sidetrack from the subject, I just think after reading this and after analyzing all this data is that I wouldn't really mind my tax dollars going to helping something for the better cause of all my fellow Americans. It's sad to see that the U.S. has not found a system which everyone can be subject and deserve a healthy and quality life. And really, after doing this assignment, it has really changed my priority and my political views for everyone in the United States, regardless of your income, race, gender, color, whatever variable you want to throw at me, should receive adequate health care, and hopefully one day we can all live to be 100. So that's it for my presentation. Once again, thank you, Professor Ha. It's been a great semester, and I wish the best to you, and I wish the best of luck to all my classmates. Goodbye.